Yes.
Thanks for having me.
Definitely. All right. So there's a lot of efficiency and all the things that make it happen where it goes from A to B quickly with your guys' company. But this is awesome. Can you talk to us about the different emergency kits that you have? I mean, ibuprofen, all the things are in here.
Yeah, so the first one, which I believe you have in your hand now, is the flu virus kit, right? This is good for any type of viral infection, whether it's influenza, it could be a numerous of different viral infections. We have Tamiflu, 75 milligrams. The one thing people don't understand with Tamiflu is that it could be used in a preventative state and it could be used in a treatment state, right? I'm not a doctor, I'm not a pharmacist, but this is everything that we learn here on the pharmacy level that patients just don't understand is Tamiflu doesn't have to be taken only when you're sick or have influenza. If somebody in your household has the flu, you cut the dose in half. Instead of taking 2 capsules, you just take 1 capsule a day for 5 to 10 days, depending on, that phase of time that you're close to somebody that's sick. So 1 capsule a day for 5 days is usually suffice. It'll help prevent you from getting the flu or influenza. If you happen to contract the flu, traditionally the symptoms aren't as worse because you already have the medication in your body fighting the virus. That's one cool thing about Tamiflu, and it's been around for ages. And it's super cheap generic drug that doctors don't like to talk about too much. They'd rather just you go to the pharmacy and get a flu vaccine that doesn't even work, as they've all stated. Then we have ibuprofen 800 milligrams. That's obviously for fever, aches, body aches, chills. Get you 30 tablets. It's plenty to get you through any type of viral infection. Then we have the Medrol dose pack. That's any type of fluid in the lungs, heavy congestion. That is a steroid pack. So, you do have to wean off the steroid pack, but it's an awesome tool to have. Then we have the Tessalon Perles. Tessalon Perles are for dry cough or any type of sore throat associated with a viral infection, which is neat. Most doctors during COVID, that's literally the only thing they wanted to prescribe was Tessalon Perles. Why? I don't understand. I mean, they're great to have for a sore throat or for a cough, but if you got fluid in your lungs, it's not helping you. It's only going to help kind of suppress the cough. My favorite, Flonase. Flonase is a steroid for your nasal cavity, kind of open up and allow the congestion to flow out. Reduce the inflammation in your nasal cavities, best used for sinus infections or any viral infections. And then the last one is an albuterol inhaler. Albuterol inhaler is what we call a rescue inhaler. Shortness of breath, wheezing, the albuterol inhaler will open up your lungs. Most people needed that during COVID when they had that wheezing or that shortness of breath. That was very popular during COVID, and for whatever reasons, doctors didn't want to prescribe it. But on a lot of our patients, we informed them that it's definitely something to have in their cabinet just in case. So all of these medications are to help subside the effects of any type of viral infection or influenza infection.
This is pretty awesome. This right here packs a punch, but then how long? So is it about 30 days? You have about a month's supply here? Is that, am I reading that right?
Well, that's probably, I would say, more of a 7-day protocol. Most viruses are 7 days. The Tamiflu, if you're using it in a prevention, it could last up to 10 days. Traditionally speaking, you only want it for 5 days for an acute infection. Tessalon Perles, we give you 40 pearls. That's enough for, 10, 20 days. Sometimes people have that lingering effect. One of the things I wanted to add to our flu virus kit, which I'm going to go over, just quickly, is NAD+. We've been encouraging a lot of our patients who come to us, specifically walk-ins, and we tell them, they're fatigued, they're beat up from the flu, they can't get out of bed. Try NAD+. NAD+ has that factor to beat fatigue. We have a couple people come in a couple days after their flu, and they're like, I feel great again. I'm back to normal. There is no lag between my virus infection. Something that you could add to your order if you'd like. You just got to give us a call. We can definitely add it. It's going to help with the fatigue factor. People are taking it in that long COVID regimen because long COVID causes tons of fatigue, brain fog. We can get you that mental clarity back. So that's something awesome to try too.
That's awesome. So these kits, I mean, there's not just flu kit. I mean, I've seen that there's this sinus and infection kit, a travel emergency kit, and then a ton of other options. I went to the website the other day, allfamilypharmacy.com/emergency-kits, and I saw a whole slew of these bad boys. I mean, this is pretty awesome.
Yeah. We have a lot of kits, emergency kit, travel kit. I like the travel kit, especially now we're up to March. I have a family cruise. People like to go on cruises. People like to go high altitude skiing. People like to do a lot of traveling. You're on different airplanes. We have anywhere from, ibuprofen for maybe you enjoyed your night a little too much the night before and you have a headache the next morning. We got ibuprofen for that. Some people get aches and pains on airplanes when they're doing a 3 to 6 hour flight. We have scopamine patches, which are anti-nausea patches. Some people use those on airplanes, and most people use them on cruise ships or when they're out on a boat. Maybe they're going fishing or they're doing some exploring. Omeprazole for acid reflux. Sometimes we like to enjoy some of our favorite foods that have a little too much acid in there. And then the azithromycin, in case you are in Mexico and you drink the water, or in case you wake up with a sinus infection or any type of secondary bacteria infection, you have an antibiotic on hand that you could start, and it's not going to ruin your vacation.
I like how these kits are also compact. I've seen some other ones out there. They're just big and bulky. This fits perfectly in, if you are traveling for the travel kit, or just having one in the pantry or wherever you would store your medications, of course. And I hear that ordering is pretty simple too. You choose your kit online, and then what happens from there? Is it a licensed doctor handles everything from there?
Yes. So we abide by all state and federal laws when it comes to physicians prescribing medications. So what you'll do is when you fill out a medical form, it's going to go to a physician who is licensed in your state. As long as the pharmacy is licensed in your state, we can also provide you that service, which we are licensed in most states. Our doctors are licensed in every single state. They'll provide you a consultation. Depending upon what is needed will depend on, the doctor and the patient. We allow them to kind of do their own thing, but they understand why you're coming to All Family Pharmacy and why you're having a consultation with them. You're looking for medications to put in your cabinet for the flu, or, for just in case, or maybe you're looking to travel a little bit and you want some drugs in your suitcase to have. One of the neat things about this kit that we've provided right now is we provide prescription labels on everything. It's TSA certified, so if there's a liquid in there, you don't have to worry about that with TSA. There's a prescription on every vial, so you could put it in a handheld bag, you could put it in a carry-on, or you could put it in your checked-away suitcase. The one thing I always mention with airplane rides, depending on where you're flying to, is some of these cold places, especially with these winter storms. You don't want the medication to be susceptible to those cold temperatures, especially when it's underneath the airplane. It can be. So sometimes it's best to have it in a carry-on on your lap where the air conditioning is running at a 70-degree temperature, and we're not freezing or harming any of the medications.
Definitely. I mean, that winter storm on the way is not a time to be putting things underneath an airplane if you're traveling at all. Even if you can get off the ground, I mean, it's going to be quite the storm. Speaking of the storm, sometimes people panic when they get sick. But with you guys, you always talk about how this is all about preparation and not panic. Can you elaborate on that finally?
Yeah. So again, we have freedom thinking physicians. These doctors want you to be prepared for the next event, right? That next event could be COVID. It could be the flu. It could be a sinus infection. It could be, a family trip that you plan for spring break because your kids are off work or off school or you're off work. So these doctors understand what the need is for the patient and why we're doing this. Your traditional PCP doctor is not going to prescribe you scopamine patches 3 months in advance because you're going on a cruise, throughout the entire Caribbean. That's just kind of the way the world has worked in the medicine realm. Here at All Family Pharmacy, our physicians want you to enjoy life. They want to give you the opportunity to hold these medications as long as they're safe and effective for you. They still have to go the route of checking medical ailments, making sure no drug-to-drug interactions happen. That is something that they're very good at. But at the same time, if they approve that prescription, you're good to go. We'll get you the kit, within 1 to 4 business days, depending upon how fast you need it. But again, like this winter storm is hitting, it's going to be bad. Shipping's going to be delayed. And these are times why we always encourage our patients or people who would like to be a patient of All Family Pharmacy to be prepared. be a step ahead of this. You know, this winter storm is not only going to delay our packages going to our patients, it's going to delay the drug coming to us, the medications coming from our wholesalers. It's going to delay a lot of certain processes that might, take a little bit longer than just a few days to get back in. So it's something to always be prepared for.
Michael, you bring up a really great point. If someone is under the weather, they're feeling that flu bug or whatever when it comes to feeling sick, and then there's a foot of snow outside, you can't travel. And that's why having one of these on hand would be great. So it's allfamilypharmacy.com/emergency-kits. You see that information there on your screen. And can you get the RSBN 10% off on this too, or no?
Yeah, so actually what we'll do, since we're live on the air, is we're going to do a RSBN 20 for all the kits. We're going to give you 20% off a kit. This is the time, February, March, huge travel months, time to go skiing, time to go on a cruise, time to enjoy time off with your kids when they're on spring break. So we're going to offer 20% off any single one of those kits that we have on our website. It's RSBN 20. So yeah, just go to allfamilypharmacy.com/RSBN and then just select the emergency kit tab, and it'll bring you to the different kits that we offer based on what your need is.
So throughout the day, throughout this broadcast, you're saying I should say RSBN 20, not RSBN 10, correct?
Yeah, let's do it. Let's do it for the rest of the week. Do it till Sunday. RSBN 20, we'll give them 20% off. It's a time for people to save a little bit of money, but be prepared up front. We want them to have the medication when they need the most.
That's awesome. The owner of All Family Pharmacy, Michael Kunzler. Thanks so much, sir, for all of your time, and thank you for what you do.
Thank you. I appreciate it.
Thank you.